Grey's Anatomy, a long-standing medical drama, has captivated audiences worldwide with its compelling characters and dramatic storylines. The show has offered viewers a glimpse into the seemingly glamorous and intense world of surgery and hospital life. However, the line between fiction and reality often blurs. While the show tackles important medical topics, it's crucial to remember that it is, at its core, a drama designed to entertain. This essay aims to dissect the medical accuracies and inaccuracies presented in Grey's Anatomy. We'll delve into the realities of medical training, diagnosis, treatment, patient interactions, and hospital practices, comparing them to their on-screen counterparts. By understanding these discrepancies, we can better appreciate the complexities of the medical profession and cultivate a more informed perspective on the healthcare system. Grey's Anatomy has not only entertained, but also educated its audience to some extent. It has sparked interest in the medical field among many viewers, inspiring some to pursue careers in healthcare. The show's portrayal of personal and professional challenges faced by doctors has resonated with many, making it a cultural touchstone. However, it's essential to approach the show with a critical eye, recognizing that while it brings attention to important issues, it also dramatizes and simplifies complex medical realities for the sake of storytelling. By doing so, we can enjoy the drama while maintaining a realistic understanding of the medical world. One of the most romanticized aspects of Grey's Anatomy is the portrayal of internships. The show paints a picture of young, eager medical interns stepping into the hospital, ready to save lives and make groundbreaking medical discoveries. The show often depicts interns as bright-eyed newcomers thrown into the deep end, expected to handle high-pressure situations with minimal guidance. They are shown performing complex procedures and making life-or-death decisions from day one, often with dramatic flair. In reality, the first day of an internship is far less dramatic. Interns spend much of their time in orientation sessions, learning about hospital protocols and filling out necessary paperwork. The initial focus is on understanding the hospital's systems and procedures rather than diving straight into surgeries. While residents do face a steep learning curve, the trial-by-fire approach portrayed in the show is exaggerated. Real-life medical education prioritizes patient safety and involves a gradual increase in responsibility. Interns are closely supervised by experienced physicians who guide them through the learning process. They are not expected to make critical decisions without oversight. The emphasis is on learning and growing into their roles over time. The long hours and demanding nature of the job are accurately depicted in the show, but the portrayal of interns working 48-hour shifts is outdated. Modern residency programs have implemented stricter work-hour limitations. These limitations are designed to prevent burnout and reduce the risk of medical errors. Interns now have more structured schedules that allow for adequate rest and recovery, ensuring they can provide the best care for their patients. The journey of a medical intern is undoubtedly challenging, but it is also a carefully managed process aimed at developing competent and confident doctors. The reality of medical internships may lack the dramatic flair of television, but it is a crucial and rewarding phase in the journey of becoming a physician. Modern residency programs adhere to stricter work-hour limitations to prevent burnout and medical errors. The focus remains on patient safety and the well-being of the medical staff. Grey's Anatomy often employs a shotgun approach to diagnosis, where doctors order a battery of tests without a clear rationale. In one episode, a patient might undergo a CT scan, MRI, and numerous blood tests before the actual cause of their symptoms is determined. This approach is not only inefficient but also potentially harmful to patients. In real-life medical practice, diagnosis is a systematic process that begins with a thorough medical history and physical examination. Doctors use their clinical judgment and knowledge to narrow down the potential causes of a patient's symptoms, and then order targeted tests to confirm or rule out their suspicions. This approach is not only more cost-effective but also minimizes patient discomfort and the risk of unnecessary procedures. Section 4. Residency realities, less drama, more diligence. The show often portrays residency as a constant whirlwind of drama, with residents juggling personal crises alongside medical emergencies. While this makes for compelling television, it doesn't accurately reflect the day-to-day life of a medical resident. While the job is undoubtedly demanding and stressful, the level of personal drama depicted in the show is exaggerated for entertainment purposes. In reality, residents spend most of their time focusing on patient care, medical procedures, and learning from their mentors. The reality is that residents are highly trained professionals who are expected to maintain their composure and focus on patient care, even under pressure. They are taught to manage stress effectively and prioritize their responsibilities. Another area where Grey's Anatomy deviates from reality is in its portrayal of medical procedures. The show often dramatizes these procedures to heighten the tension and keep viewers on the edge of their seats. The show often shows residents performing procedures without proper protective equipment, such as eye protection. This is not only unrealistic but also dangerous. In a real hospital setting, adhering to strict infection control protocols is paramount. Hospitals have stringent guidelines to ensure the safety of both patients and healthcare workers. Residents are rigorously trained on the importance of wearing gloves, masks, and eye protection when handling bodily fluids or performing invasive procedures. This training is crucial for preventing infections and ensuring a safe working environment for everyone involved. Section 5. Patient Interactions, Empathy, and Ethical Considerations. Grey's Anatomy excels at portraying the emotional side of medicine, showcasing the raw and often heart-wrenching interactions between doctors and patients. The show highlights the importance of empathy and compassion in providing patient-centered care. However, the show sometimes crosses ethical boundaries in its depiction of doctor-patient relationships. In one storyline, a doctor becomes romantically involved with a patient, a clear violation of professional boundaries. While such situations may make for compelling television, they are highly unethical and could result in serious consequences in real life. Doctors have a responsibility to maintain professional boundaries and prioritize their patients' well-being above all else. Section 6. Hospital Practices, Separating Fact from Fiction. Grey's Anatomy often takes liberties with hospital practices for dramatic effect. For instance, the show frequently depicts doctors discussing patient cases in public areas, such as hallways and elevators. In reality, such casual conversations about confidential patient information would be a blatant violation of patient privacy laws. Hospitals have strict policies in place to protect patient confidentiality. Doctors and other healthcare providers are only allowed to discuss patient information with authorized personnel and in appropriate settings, such as during rounds or in private consultation rooms. Section 7. Conclusion. Embracing the drama, appreciating the reality. Grey's Anatomy, while a fictional drama, has undeniably brought attention to the medical profession and sparked conversations about important healthcare issues. However, it's crucial to remember that the show's primary goal is to entertain, not to provide a realistic portrayal of medicine. By understanding the discrepancies between the show's dramatic portrayals and the realities of medical practice, we can become more informed viewers and appreciate the complexities and nuances of the healthcare system. Ultimately, while we can enjoy the entertainment value of medical dramas, we should rely on credible sources and healthcare professionals for accurate medical information. Please like, share, and subscribe for more